Welcome to the podcast. I'm your host, Jim Jorgensen, and today I'm joined by Jim Jacobson and Joel Hall to discuss hospital strategy and, in particular, infusion strategy. So, thank you both for making some time to participate.
Absolutely. Happy to be here.
Great to be here.
Great. Let's start with a bit of your personal background. What are you doing now, and how did you get there? Let's go Joel first, and then Jim.
Absolutely. Yeah. So my name is Joelle Hall. I'm a director of infusion strategy here at Visant. I have been with the company for just over a year now. Prior to joining, I served as the system director of infusion services for a large health system where I helped to establish and grow their home infusion service line from the ground up. Prior to that, I got my PharmD from Ohio Northern University and completed HSPAL residency at UW Health in Madison, Wisconsin. Nowadays, I am based in Boston, Massachusetts, and just help to serve our health system clients across the country to establish infusion services. So thanks for having me on today, Jim.
Our pleasure. Thank you.
And I'm Jim Jacobson. I'm the Chief Growth Officer here at Visant. I joined earlier this year. I'm a strategy nerd by background. I started in political strategy and spent the first 13 years of my career in politics. I made it out safely. And from there, I moved into health system strategy at a smaller strategy consulting firm that was eventually acquired by a much larger organization, and where I concluded my time there after 14 years running sales and client relations for their analytics business.
Well, politics to healthcare. I don't know if that's much
Yeah.
safer, but
So far it feels a little safer. We'll see. I'm not done yet.
exactly. With both of you having the opportunity to work all over the country, with really a wide variety of hospitals and health systems, what are you seeing in terms of general overall strategy?
Yeah, over the last 14, 15 years, I've worked, I think, in about 40 different states. So I've had a chance to see all sorts of different market dynamics, evolution of what's happening in the marketplace. So I think I push things back to when we started to see outpatient shift of volumes, right? So we were starting to see hospital inpatient moving to outpatient, but over time we've continued to see this decanting of volume from higher acuity sites of care down to lower acuity sites of care. So that forced health systems to start to have to create a broader care continuum, right? Not just the hospital campus, but moving to surgery centers and urgent cares and retail care and delivering services in the home and expanding their physician footprint as well as all the post-acute care. So while that was happening, there was a ton of disruption. These what I call non-traditional competitors, so non-health systems who are sort of nibbling around the edges at the all of that care continuum that wasn't on the hospital campus. You're not seeing anybody move into hospital care. They're saying, hey, we're going to leave that to health systems. But organizations like Optum and other are building their own care continuum that essentially mirrors that of the health systems, but with everything except for that hospital campus. And then you're seeing, and they're not just doing it because they are acquiring these providers, but they're also these like payviders. So they've got this ability to influence healthcare spend through payers. A lot of private equity backed firms trying to identify like where soft spots are in those health system care continuums so that they can siphon off volume from health systems that are profitable for them. And then you've also got like a lot of virtual sort of digital players in the marketplace. So health systems are having to take all of that into consideration and not only acquire parts of their care continuum, but connect them and make it easy for patients to navigate that. That's the hard part. The acquisition isn't quite as hard, but it's really about creating this seamless experience for patients, which is really complicated. And these smaller organizations are much more nimble. They're super consumer focused and and really like zoom in on that customer experience. So we've seen that in the ambulatory surgery space. We've seen that in urgent cares. We've seen that for freestanding imaging. And now we're going to talk a bunch today about the infusion marketplace. But this is what's been happening in healthcare. It's the shifting from volumes all over. Strategy of these health systems are try to capture as much volume and reduce as much leakage as possible. And they're up against these competitors who are just, again, going right after their weak spots. So Joel, what about you? What are you seeing?
I think everything you said, copy paste and just apply it specifically to the infusion services that we're seeing. It's certainly that shift to lower sites of care, a much more consumer driven mindset. And we have certainly an aging population that's needing more and more infusion services, but also a decent prevalence of chronic disease in the younger population. And again, those folks are extremely consumer mindset focused and want convenient, accessible, and want it to be easy for them to navigate. And to your point, those third-party folks, they know how to do that and are weaseling their way in to find a spot for themselves. So completely agree with that being the shifts and strategies and trends that we're seeing across the market.
With these emerging patterns and changes, are you guys seeing anything in terms of construct of the C-suite, different players that we should be aware of?
So I think there's certainly the chief strategy officer continues to be elevated. The chief transformation officer is increasingly a title that we've seen more and more. And then finally, the one that started maybe 8 or 10 years ago, but has become even more prevalent is chief experience officer. So the CXO, as health systems are trying to make sure that they're delivering care that is consumer friendly, that they're meeting those expectations. They're competing with these other organizations. And like the digitalization of everything else in our world has made us also eager to have a quick and easy solution for everything. And health systems, healthcare hasn't really been ready for that. So the chief experience officer is one that's been elevated. And Jim, most of the times we see those folks coming in from outside of healthcare, coming in from hospitality industries and other industries that are not in that health system space.
Poaching from Disney.
Yeah, for sure.
Let's take it down maybe another level. How are these strategic directions really impacting pharmacy? And then maybe second part, what can pharmacy do to best position itself to take advantage of these strategic initiatives?
Yeah, I think pharmacy is really well positioned and right at the center of a lot of these shifting trends, and they're in a good spot to play an active role in the system to addressing these, right? Pharmacy is extremely involved, if not oftentimes the leader or owner of infusion services within a health system. So to be able to redirect and find innovative ways to recapture that leakage from these other competitors is really key. And I think, to Jim's point, sometimes the folks that are looking at strategy and leading these initiatives are not health system background or especially not pharmacy background. So I think it's extremely important that we do have pharmacy leaders who understand that and know how to speak the language of those C-suite folks and can communicate the benefits of infusion services and specifically the role that pharmacy plays in the delivery of those services to be able to really highlight that value that it can bring to the system overall.
Yeah, I think understanding consumer preference is really interesting. I tell this story. I have a very good friend who's a gastroenterologist who one time a couple years ago was bragging to me that he had a 4-month wait to get in to see him for a colonoscopy. And I was like, no, man, not a good thing, right?
Not a good
And
look.
so yeah. So we have to be able to serve a healthcare consumer that's expecting to be able to get in quickly to see a provider, and health systems aren't always the most nimble in that way, and that's where these competitors could really siphon off that volume, as I said earlier. I think understanding the disruptors and their business model, looking at the markets that they've moved into and what happens once they've moved into a market so that you can be prepared and start to see those signals early. And then working with your strategy team to create a strategy overall about how you're going to kind of protect your patient base and be able to provide a care continuity for your patients.
So let's dig into infusion services a little bit deeper. On a macro hospital level, what are you seeing in terms of general health system strategy for infusion services?
Yeah, I think frankly, what we see in this space sometimes is maybe a lack of refresh or innovative strategy. Hospitals have relied for a long time on their hospital-based infusion centers to deliver this care because that's the highest level acuity, oftentimes really right our highest level of reimbursement. So for a long time, that's been a great strategy and the best way to keep patients close and to keep dollars in house. So I think a lot of our hospitals have historically just relied on that. That's obviously becoming more and more of a problem as we're seeing this shift, not only from payers driving patients out of there, but patients maybe not preferring to go to those hospital-based locations. So if that's the instance and patients are looking for something that's not hospital-based, a lot of health systems have really had a really heavy reliance on external infusion providers to care for their patients, which financially is obviously not a good thing for the health system with those dollars following those patients out the door. But clinically and from a patient experience, it's not preferred either. It's much harder to have that follow-up and transparency into that patient's care once they leave the door. So I think what we're seeing now is the beginning of a shift of health systems realizing, oh gosh, we're a little bit behind on this strategy. These third-party private equity folks have already moved into this space. how do we catch up? How do we start to recapture maybe some of what has already leaked out to them? So I think a lot of folks across the country are realizing they need to have a bit of a reset and a shift of their infusion strategy to be more creative and innovative.
I think it's critical too to be proactive in that space, because even if you aren't losing patients yet, the potential to lose them is certainly there. And once they're gone, in my experience, it's very, very difficult to get them to come back.
Definitely much harder to recapture than to, plug the leak before it starts.
The other thing to note, that's a really good point, Jim. Another thing to note is that when I've studied this in other aspects of health system strategy, when a patient leaves, it doesn't mean they're automatically coming back. So even if we would study all sorts of patient patterns and look at things like imaging, and look when patients would leave to go get imaging outside of a health system because it was faster, that often completely changed their care afterwards, right? So it wasn't that they just went to get imaging and would come right back to that health system. We have to be sure that, these folks are they're sort of being lobbied by other health systems to work with them, and they're talking to those patients on a daily basis and providing their own guidance about where they should go next for their care. And that may be back to your health system or it may not be. So we can see these disruptors not only pull volume out in the near term, but can also affect your patient continuity further down the road.
From the pharmacy perspective, I think an effective strategic and tactical plan can be really complex. There's lots of moving parts and touch points that extend across the entire organization. So what are some of the key elements that we should be considering?
Oh gosh, a long list, Jim. I mean, let's see how concise I can be. I think, infusion services are inherently complex and really do require deep interdisciplinary collaboration and knowledge just beyond maybe the more obvious clinical practice or operational structure. But I think structure is the first piece to keep in mind. As we've touched on, health systems typically have a fairly solid hospital outpatient infusion structure, and that they probably have in their wheelhouse. What we are seeing more health systems trying to include in their structure are home infusion and other pharmacy-based infusion sites, such as alternate site infusion or ambulatory infusion suites. I think really what we're seeing from a structure standpoint is that ideally health systems have multiple sites of care. They have hospital-based, physician-based, home infusion. The more options they have at their fingertips, the better, armed they are to face any of these additional shifts and have the right spot for the right patient, the right therapy, the right payer to really match all of those things up. Each of these sites, though, comes with some unique benefits and challenges. What may be appropriate for a hospital-based infusion center is maybe not a therapy that would be appropriate to administer to a patient in the home. I think it's also important to keep in mind with that structure that there's definitely scaled reimbursement rates and financial implications. So by no means should health systems shift to move all of their volume to those lower sites of care. Clinically, that doesn't make sense. Financially, it certainly doesn't make sense. But there needs to be a balance of that structure to have as many options, available as possible. And I also think beyond just the actual structure and infusion location offerings, that there's a lot of payer strategy and financial considerations to keep in mind when you're thinking about key elements. You really need to have a strong relationship and connection with your managed care contracting team and really be plugged into what site of care mandates and policies are impacting your area, whether that's on a national level or locally and, right on site. So I think having more robust infusion offerings really helps health systems more strategically negotiate with those payers, have some leverage on, maintaining the highest rates possible at those hospital-based sites while also offering those lower level sites of care for less significant reimbursement. Again, I think if you are accepting those lower reimbursement rates at those alternate sites of care, it's important to structure them as such and understand that they're going to be different than your hospital-based centers. That's your highest level acuity, highest level of resource really required on site there. And understanding that trying to build out an alternate site or a home-based service line to that same level of complexity really doesn't make sense financially to invest that same level of spend when you're not going to be receiving that same level of reimbursement. So I think the other thing to keep in mind from that payer contracting strategy when you are seeking contracts for those alternate site or home infusion rates is that these are really unique reimbursement codes and unique language that's going to be included within those contracts. So it's important to understand that you're getting what you need to fully deliver those services. It's coding that isn't used within the hospital-based environment. So making sure that you have the codes needed that you'll be reimbursed for the full scope of services at these alternate sites is extremely important to make sure that you have the setup that you need. So I think that's an extremely important element. Maybe another important element is again just thinking about the medical staff engagement and provider satisfaction. We know that this is really key within any health system setting, and infusion services is no different. Keeping providers satisfied is extremely key for retention overall. And I think that what we've seen is that the more that providers have to coordinate this infusion care externally for the patients, oh, it's a huge dissatisfier. It's a lot of extra work and coordinating patients. It's manual faxes and orders and phone calls. Their notes aren't right in the EHR for them to reference. It becomes a huge headache, frankly. And our providers are doing a lot already, that any added burden like that, it becomes really challenging. So if we can bring that in-house and make it easier for them, we can definitely see a large uptick in that provider satisfaction. I will also say, though, that our competitors are equally, aware of that. And so they're doing everything possible on their end to make it the easy button. Sure, send your referral out to us. We'll do everything for you. So they've found some ways, again, to get into those cracks, and they know that provider satisfaction is key too. And they're doing everything they can to make a change there as well. I think one of the other then key pieces of this to me is how do we, retain and recapture some of those patients? We've already touched on the consumer experience a lot here, but I think again, that's really key. I think alternate site and home infusion allows us to both literally and figuratively meet patients where they are at. If you have an alternate site infusion location, it can be in a strip mall with easy parking in and out. It's not like your typical hospital-based structure where you're in a garage getting a ticket, walking across campus. These things may seem small, but they can add up to be significant barriers to patients wanting to receive their care on site at the hospital. And what we're seeing from these third-party competitors is they're creating really convenient, really luxe, white glove, spa-like experiences for our patients to receive these infusions. And I think this shift here towards, again, convenience and what the consumers are wanting kind of reminds me of the initial shift in community pharmacy to put in drive-through pharmacy pickup, right? That we gave patients what they want. They expected a level of convenience, and I think this is that next shift towards infusion. How can they make it more and more convenient and patient-centered? So I think that really making sure we have a strategy again that can make it patient-centered and meet them where they're at is important as well.
Yeah, I think Joelle nailed that, and I'll be the I try to be a simplifier in everything that I say. So I'm going to use I love strategy frameworks. I'm going to use a marketing framework to kind of wrap this up, put a bow on it. So I'm going to use the 4 Ps of marketing. The first is the product. Joelle touched on this, but experience is your product here. If you're a health system, it's creating the right experience for your patients, whether that's in a hospital outpatient setting and for infusion, or in an ambulatory suite, or at home, right? So meeting them where they want and need you to meet them. Second is around price. So that's about what Joelle was talking about in terms of site of care optimization. Obviously, there's more that goes there with 340B, drug acquisition costs, all those kinds of things too. But so you've got your product, which is your experience. You've got your price, we just touched on. The footprint is your place, right? That's the third P. So having the right footprint to make sure that you can, I think as Joelle said, maybe I'll simplify it. It's good to have options, right? So it's good to have options, build out your options so that you can meet patients where they are. And the fourth P is promotion. So you've got to promote your new footprint, your new strategy, your plan to your physicians, to your patients, to your payers and your employers in the marketplace. And then frankly, you need to do what much of the rest of the health system has done in terms of engage with business development and those liaison programs to be able to help steer volume to the places where you want it to go, right? Have influence over your patients and help guide them, be a strategic advisor to them and help them get to the right place. I can tell you those non-traditional competitors have absolutely employed these people in your marketplace,
Oh yeah.
and they are literally in your hospital outpatient departments suggesting to patients that they come see them. So you need to take advantage of those teams that you have in-house or build them out to be able to capture the volume that will help justify the investments you've made as you've continued to build out your footprint. So
Yeah. And I think, Jim, that's not something that maybe inherently comes to all health system pharmacy leaders, especially if you maybe are driving from more of an inpatient background. Typically, if your patients need you, they come to you. You don't have to go out and market to them or find them. But I
Yep.
think especially with these, shifts in the competitor landscape, health systems need to put on a sales mindset and compete with those and have liaisons that are really singing the praises of those services and making it clear why that is of value and why patients should want to use these infusion sites.
Well said.
I think the only other element that we maybe didn't touch on that's I think really important to keep in mind across infusion services is just analytics. It's really important to make sure that you have KPIs to measure the performance of this and keep in mind that those are going to run the spectrum of clinical, financial, operational. You want to make sure that you really have a way of measuring all of those and have sound performance. In addition to maybe some homegrown KPIs or ones that can be used across the health system, there's likely going to be some data elements that are required from an accreditation standpoint. It's always important to make sure that your program has the right metrics to maintain accreditation standards. And again, there's oftentimes synergy that can be found between your infusion services, your specialty pharmacy, where you can capitalize on maybe some existing accreditation metrics. Again, it's really hard to track some of these things if your patients are receiving these infusion services externally. So bringing that in-house gives you a lot more data that you can leverage and make informed decisions based on. So having some robust reporting and analytics options is also going to be key to having these successful infusion programs.
What about that mid-sized hospital that says, hey, I think I have enough patients for an infusion service, but this is just overwhelming. We don't have the resources or the expertise to do this. Talk to me a little bit about partnership options that are available.
Yeah, I would say there's plenty of partnership options available, and medium size, small size does not discriminate. There's a lot of ways that, VSANT can partner to help serve those clients and really dig into understand where does that leakage exist? What does that opportunity look like? With a lot of that data existing externally, it can be hard for health systems to wrap their arms around that without having all the information that they need. So certainly we can come in to just help highlight what opportunity does exist. I think we have, a variety of options to help support them in their venture of launching these infusion services, whether it's in a more supportive advisory capacity or to a higher level of partnership in helping to manage some of those services. There's a lot of options that exist. And again, size doesn't discriminate.
And I would suggest, as we were talking earlier about what pharmacy can do to meet other parts of the organization at the right point, or often strategy here in this case, health systems tend to have an approach to to what they want to do around build, buy, and partner. And so the more that you can understand, the chief strategy officer is often at the center of those decisions around build, buy, partner. And the more that you can understand historically the appetite to do each one of those things of your health system, the better informed the pharmacy leader can be as they go and have those conversations with strategy and other parts of the health system leadership team.
Typically, what might a hospital executive expect for a return on investment on an infusion service, just in terms of timeline? Is it something that they can expect to see the funds come in fairly rapidly, or is it a little bit longer?
Yeah, I think that's a great question, Jim. And I think it depends on really the level of services that we're expecting to deliver. So certainly if we're going to go full bore, full scale home infusion, it's going to require the build out of a new sterile compounding clean room facility. You're going to have some higher investment up front that might take a little bit longer to see your returns on. If you're moving forward with really just a specialty focused ambulatory infusion suite strategy, those can be fairly low upfront investments. They're not, again, not your full robust facilities. You can place a few infusion chairs in some unlicensed space and see a lower level investment on the front end. I'd say we typically see a return on investment anywhere from year 1 to 3, again, just depending on those initial upfront costs and how fast you can scale that growth. I think what we see is certainly some speed to value with having some partnership help you get in there and increase those capture rates sooner than later. But again, it's not unheard of to see some return within even year 1, certainly year 2.
And I would say, and Joelle, you're the expert on this, not me, but as I have learned quickly here at VSANT, I think a really important partner in launching this is the managed care team, right? They are a key to being able to start seeing revenue come in based off of how quickly you can get those managed care contracts closed. What do you want to add there, Joelle?
Oh yeah, I just completely agree. Having a strong relationship with that managed care team and really being able to highlight the priority of these contracts can make a big difference in how quickly you can start seeing patients and being reimbursed. And I'd say the other really key team to ensure that you have sound support for is your revenue cycle team. You know, as mentioned, the complexity of the payer contracts up front, that complexity of revenue cycle on the back end is doubled, you know, and so having a team that really understands how to maximize what you're able to be reimbursed for and really sound billing practices, again, is going to create that speed to getting the return on your investment as long as you can get paid timely and for all the services that you deserve to be paid for.
Yeah, the way that we talk to our clients about infusion always includes conversations around med access and rev cycle, right? Making sure
Absolutely.
that we wrap this infusion investment with those services to ensure that you're gonna get the most value out of your program.
Yeah, absolutely. It needs to be all encompassing front end to back end. And again, the closer that your medication access and kind of intake prior auth teams can work with your back end revenue cycle teams, the smoother and better that process is overall.
Well, this has been great. And, we could probably fill up the rest of the day on this. I do want to be respectful of your time. Any last thoughts before we wrap up?
I'm just happy we had the chance to talk about infusion from the lens of strategy, and Jim, the insights that you can share specifically from that strategy lens and how we can start communicating this is really a hot topic that those chief strategy officers and other folks need to be paying attention to this. And again, you don't want to wait too long to jump on this train.
Yeah, partner with other people and understand your health system patterns, and it'll make you, as a pharmacy leader, that much more informed getting to the table. So this was really fun, Jim. Thank you. Joelle, you were amazing. Thank you.
Likewise.
Yep, absolutely. Joelle and Jim, thanks again for being guests on the podcast. And thanks everyone for listening.
Take care.
Thanks all.